Okay, this is an article that just came out on Addiction Now, and it's dated August 21st, 2017. Nearly 92 million adults use prescription opioid, new government report. Over one-third of American adult population were past year users of prescription opioids at least once in 2015, according to a new government report by the Substance Abuse and Mental Health Services Administration. Of that fraction, about 91.8 million, or 37.9% of all American adults, 11.5 million, 4.7%, misuse prescription pain relievers. The 2015 National Survey on Drug Use and Health report revealed misuse can lead to health problems, addiction, and fatal overdoses. The level of overdoses is a crisis, and it requires all of our efforts to turn the tide. No, it doesn't. Um, that means changing prescription practices to reduce the number of people developing a problem, ongoing outreach risk reduction, activities like widespread distribution of naloxone and treatment, especially medication-assisted treatment and recovery support available upon demand. Only marijuana comes ahead of prescription opioids as the country's most used illicit substance. And even though misuse of prescription drugs is frequent in the US, most who use prescription opioids, 87.2%, didn't misuse them. Yet, the researcher believes understanding the reason for misuse could have major important public health implications because policymakers can utilize this information to help guide their assessment of drug use, prevention, and treatment in their cities. Okay, if you have a family history or your own history of having a substance abuse disorder, discuss this with your physician and ask for a plan for how to manage issues if pain medication is absolutely necessary. Additionally, 11.5 million adults use prescription pain reliever improperly on at least one occasion in the past year. Physical pain was cited as the most frequent reason misuse occurred, 63.4%. In the mid-90s, we began to concerted efforts to better address pain, Johnson explained. Pain was identified as the fifth vital sign, and hospitals and other healthcare providers were evaluated by accrediting bodies on how they address pain. Opioids became the primary tool to address pain regardless of the type of pain. Okay. Okay. 57 million adults on at least one occasion within the past year, 46.2% of them misuse in order to relieve tension or relax, and 21.2% misuse to aid in sleep. Prescription stimulants were misused by about 4.8 million adults on at least one occasion in the past year. 28.4% misused to stay awake or alert, 26.2% to concentrate, and 22.4% to study. And 1.4 million adults misuse prescription sedatives within the past year. 73.2% of them misused in order to sleep. Until last year, when the CDC released prescribing guidelines, There was continued growth in the number of opioid prescriptions, she added. However, the number of prescriptions do appear to be decreasing over the past year. Yeah, but the drug addiction is not decreasing because if they can't get the opioids from their doctor, they just turn to the street drug. So it's really not putting a dent in anything by having the doctors reduce the number of scripts. Remember, there's the dark internet. There is shipments coming in from China, still synthetic opioids coming across the Mexican and Canada border. So you're really not putting a dent in this plague. It's not going anywhere. And quite frankly, when I read these articles, it just tells me they really truly don't know what the hell to do. They have poured tons of money on this plague alone with the opioids, and it just keeps growing stronger and stronger. And I already did an article a few days ago on how it's increasing among teens. So it's not going anywhere, ladies and gentlemen. Please leave your comment and subscribe, and if you can donate to my channel, please do. 92 million adults, that's a hell of a lot of people. Peace, family.